Well, if you have ever smoked or if you have a family history of coronary artery disease, a new test could shed light on your risk of suffering a heart attack.
Wow, what a valuable test. Fox 13's Dave Nemeth joins us with this week's Booming Forward and more on this potentially life-saving test. I've never heard of something like this before, Dave.
Well, it's relatively new, Kelly. It's a quick, inexpensive way to determine your chances of suffering a heart attack. Now, it's a type of CT scan that measures the amount of calcium buildup in your heart's arteries. It's called a coronary calcium score, and it's enlightening patients and saving lives.
The heart. It's what keeps us ticking, so to speak, but age has a way of challenging your ticker's ability to function at optimal capacity. A new test is giving doctors a better look.
It gives us an opportunity to kind of get a little peek in what's going on with the heart.
A very thorough peek, detecting and precisely measuring calcium buildup in the main arteries carrying blood into and out of the heart.
I think this is the best test for someone who's over 50 who has any question about what's going on with their heart health.
Dr. Andrew Behunin is a cardiologist with St. Mark's Hospital in Salt Lake City and says the hospital's new CT scan is able to spot potential problems before they become serious.
So this machine not only gives us the ability to perform these coronary calcium scores, but also more sophisticated scans where we can again see those coronary arteries with amazing magnitude.
For those who have certain risk factors, Dr. Behunin says this is the test to have.
Tobacco abuse, high cholesterol, high blood pressure, strong family history of coronary disease, those are the folks who should get this test.
The test is non-invasive, painless, and takes only about 10 minutes.
This is your EKG tracing up here. So again, we're just syncing up the machine to you to give us those crystal images.
Unlike a stress test, the calcium scan requires little effort. You lay down, usually in your own clothing, a few leads are attached to your chest, and into the donut-shaped machine you go.
Breathe in. Hold your breath. Breathe.
In a matter of minutes, I had my preliminary results.
These are some representative images from your scan. This is the territory of where that anterior descending artery comes. And the computer picked up where that plaque is and colored it pink.
It turns out I did in fact have a small amount of calcium buildup in one of my main arteries. Not enough to worry about yet, but at least now I know, and my primary care physician can take it from here.
This test is going to help guide your doctor in making those decisions.
All right, now in the medical profession, the article here, or the artery rather, that was affected is often referred to as the widowmaker, so you can be sure I'll be keeping an eye on that. That's this week's Booming Forward. In the newsroom, Dave Nemeth, Fox 13 News, Utah.